Have you ever looked at a muscle, thought, I definitely learned this before, and then realized you can't remember its origin, insertion, or even the action? You're not alone. A lot of students and professionals do not struggle because they are incapable of learning anatomy. They struggle because anatomy is often learned in a way that produces short-term familiarity rather than long-term recall. You revise it for an exam, you remember enough to get through the assessment, then a few weeks or months later, much as it feels as though it's disappeared. So you start again. In this video, I am going to give you a simple system for learning anatomy in a way that's easier to understand, easier to retrieve, and will more likely stay with you. I'm Jen. I'm a sports injury rehabilitation student, personal trainer, sports massage therapist, and biomechanics coach. This is the third video in a short anatomy series for physiotherapy and sports injury rehabilitation students, clinicians, massage therapists, and personal trainers who want to understand anatomy rather than repeatedly memorizing and forgetting it. This is the third video in a short anatomy series for physiotherapy and sports rehabilitation students, clinicians, massage therapists, and personal trainers who want to understand anatomy rather than repeatedly memorizing and forgetting it. In the first video, we looked at why muscle origins and insertions can be so difficult to remember. In the second, we used the gluteus medius to show how attachment points, fibre direction, and joint position can help us reason through what a muscle does. Now I want to bring that into a practical study method. The system has 6 stages. First, learn the region. Second, learn the bones and landmarks. Third, add the muscles in manageable groups. Fourth, connect attachments to actions. Fifth, practice recall. And sixth, revisit the information using spaced repetition. Let's take those one at a time. Learn one region at a time. One of the quickest ways to becoming overwhelmed by anatomy is to try to learn the entire body all at once. You may begin with the shoulder, move on to the hip, and suddenly find yourself looking at the muscles of the foot before returning to the spine. The information often becomes disconnected and difficult to organise. Instead, choose one region. It may be the shoulder, the hip, knee, ankle, spine, or another area relevant to your study or work. Stay with that region long enough for the structures to begin relating to one another. You're not trying to master everything in one sitting, you're just building a map. Once that map becomes clearer, the details have somewhere to go. Learn the bones and landmarks first. Before learning where a muscle attaches, make sure you actually understand the structures that it's attaching to. It might sound obvious, but it's often skipped. You're trying to remember that a muscle attaches to the greater tubercle of the humerus. You can't actually confidently locate the greater tubercle of the humerus. The attachment remains quite an abstract phrase. The same applies to landmarks such as a coracoid process, ischial tuberosity, tibial tuberosity, iliac crest, or the greater trochanter. By identifying the major bones in the region, you can learn the most commonly used landmarks. Look at them from different angles and find them on a diagram, skeleton, or model. Where appropriate, locate palpable landmarks on yourself. You don't need to learn every tiny feature before moving on. Focus first on landmarks that repeatedly appear in muscle origins and insertions. That helps to create a framework for everything else that follows. Add muscles in manageable groups. Once you're familiar with the bones, begin adding muscles. Don't just try to learn 30 muscles in one session. Group them in a way that makes sense. You might organize them by region, compartment, layer, or shared function. For example, learning the thigh, you might begin with the anterior compartment before moving on to the medial or posterior muscles. If you're learning the shoulder, maybe begin with the rotator cuff muscles before adding the larger ones that move the scapula or humerus. There's no perfect number of muscles to learn at once. The right amount is the number you can study without everything beginning to blur together. For some people, that just might be 3 or 4 muscles. For others, 8 or 10. The important thing is that you can still distinguish one structure from another. But each muscle begin with the name and location, then add the origin and insertion. After that, add the main actions. You can layer in the innovation and the other details once the foundation is secure. Trying to learn every detail simultaneously can increase the load without improving understanding. Connect attachments to actions. This is where anatomy begins to move away from memorizing lists. When you learn the origin and insertion of a muscle, don't immediately jump to memorizing the stated action. Pause and examine the muscle. Where does it begin? Where does it finish? Which joints does it cross? Does it pass in front of, behind, medial, or lateral to the joint? What direction do the fibres run? Then you can ask, if this muscle shortens, what would it pull towards what? For example, like a muscle crossing behind the knee might be able to contribute to knee flexion. A muscle crossing in front of the hip might be positioned to contribute to hip flexion. A muscle attaching onto the radius may influence the position of the forearm differently from one attaching onto the ulna. That does not mean you can derive every muscle action perfectly from a diagram, but the body is three-dimensional and function changes with joint position and task. But the reasoning process gives the information meaning. Instead of learning that a muscle performs an action simply because the textbook says so, you can start to begin to see why. And that makes the action easier to understand and remember and apply. It also helps you avoid thinking about muscles as one action structures. Many muscles can contribute to different actions depending on position, load, and which attachment is relatively fixed. Learning anatomy should give you the options for reasoning, not a collection of rigid rules. Practice recall rather than recognition. Now, this is one of the most important parts of the system. Rereading information can feel productive because the material becomes increasingly familiar, but familiarity can create false confidence. You look at a page and think, yeah, I know this. Then somebody asks you the question without the answer in front of you and your mind just goes blank. And that is the difference between recognition and recall. To improve recall, close the notes, cover the labels, look at an unlabeled image and try to identify the structures. Ask yourself where the muscle originates before checking the answer. Draw the muscle on a skeleton. Explain it out loud as though you're teaching somebody else. You don't need to produce a perfect anatomical drawing. The aim is to retrieve the information without relying on the page. You could use questions such as, where does this muscle originate? Where does it insert? Which joints or joints does it cross? And what are its main actions? What direction do the fibers run? Can I locate it on an image? Could I explain why it produces those actions? If you can't answer, then that's not a failure. It's useful information. It shows you exactly what needs revising. Testing yourself should not only happen after you feel confident. Testing yourself is part of how confidence is built. Use spaced repetition. The final stage is revising the information at gradually increasing intervals. Trying to learn something once and remember it forever is unrealistic. Forgetting is part of learning. The useful question is not how do I avoid ever forgetting? It is when should I revisit this so it becomes easier to recall next time. That is the principle behind spaced repetition. Information you struggle with appears more often. Information you recall easily appears less frequently. And over time, the gap between successful reviews becomes longer. This is where flashcards can be particularly useful, but the quality of the flashcards matters. A card should test one clear piece of information. So, for example, where does the gluteus medius originate? Where does the gluteus medius insert? What are the main actions of gluteus medius? And trying to place the origin, insertion, action, innovation, and clinical application on one card can make it difficult to know which part you actually remembered. It also makes the card feel much heavier to review. Keep the questions focused, then answer before revealing the card. Do not simply flip it because the wording looks familiar. You can also use image-based cards where you identify a structure, attachment point, or region. For anatomy, visual recall is particularly useful because knowing the words is not the same as being able to locate the structure. Anki is one tool that uses spaced repetition. It schedules your cards based on how well you recalled them. which means you do not need to decide manually when each card should be returned. But Anki is not magic. If you add hundreds of cards in one day and attempt to learn them all, it can quickly become overwhelming, and the aim is consistency, like not punishment. Start with a manageable number of new cards. Complete your reviews regularly and allow difficult cards to return. Try to avoid pressing easy simply because you recognize the answer after seeing it. The rating should reflect how well you recalled it before revealing the answer. What does this look like in practice? Let's imagine you're learning the muscles around the hip. On day one, you might review the bones of the pelvis and proximal femur. You identify landmarks such as the iliac crest, ACIS, ischial tuberosity, and greater trochanter. Then you choose a small group of muscles, perhaps glute max, med, min, maybe TFL. You look at each muscle on a diagram and identify the origin and insertion. You follow the direction of the fibres. You consider which joints are crossed and what actions are likely. You then close the material and test what you can recall. After that, you complete a small set of flashcards. The next day, you review the cards that are due before adding in more. Later in the week, you return to an unlabeled diagram and see which structures you can identify. The following week, you connect the muscles to movements such as walking, hip abduction, or single leg stance, and you might compare them with other muscles in the region. That is very different from reading an entire chapter once and hoping it remains stuck in there when you need it. Do you need to study every day? Not necessarily. The best schedule is one you can maintain. 10 or 15 minutes of focused recall several times a week may be more useful than an exhausting 3-hour session once every few months. You could attach anatomy revision to something already in your routine, like habit stacking. Perhaps even review flashcards whilst having a coffee before your lecture or during the train journey, maybe even at the start of your study session. And the smaller the barrier to beginning, the more likely you are to continue. You also don't have to wait until you've forgotten everything before revisiting it. Regular brief exposure keeps the information active and makes future learning easier. The final piece is application. Once you have learnt a muscle, look for opportunities to use that information. If you're a personal trainer, examine how the muscle may contribute to an exercise. If you're a massage therapist, consider its location, depth, and surrounding structures. If you're studying physiotherapy or sports rehabilitation, connect it to assessment, movement, even rehabilitation programming. If you're coaching, think about structures that contribute to the task without reducing the entire movement to one muscle. You could also explain the anatomy to another student or colleague. Teaching exposes gaps very quickly. It forces you to organize the information and communicate it clearly. Just be cautious not to overstate what anatomy alone can tell us. Knowing which issues are present in an area does not prove which structure is causing pain. Knowing a muscle's action does not mean every movement pattern can be explained by weakness in that muscle. Anatomy gives us a valuable foundation. It doesn't replace a full wider assessment or the biological, psychological, and social context of the person in front of us. So let's begin the full system together. Choose one region, learn the bones and landmarks, add muscles in manageable groups, connect the origins and insertions to fibre direction, joints crossed, and possible actions. Test your recall without looking at the answer, then revisit the information using spaced repetition. Finally, use the anatomy in the context of movement, exercise, assessment, or rehabilitation. You do not need to learn everything immediately. You just need a structure that allows you to build knowledge gradually and return to it before it disappears completely. That is also how I've structured my anatomy course. The course takes you through musculoskeletal anatomy in clear sections with a particular focus on muscle origins and insertions. It's designed for physiotherapy and sports rehabilitation students, clinicians, personal trainers, coaches, and massage therapists who want a stronger working knowledge of anatomy. I've also created anatomy Anki decks to help you practice recall and use spaced repetition without having to make every card from the beginning. The course gives you the structured teaching. The cards give you a way to keep testing and revisiting the information. You can find links to both below this video. You don't need to become someone who never forgets anatomy. You need a reliable way to notice what you've forgotten, retrieve it again, and strengthen it over time. Stop judging yourself for having to revisit the information. Just stop starting from the beginning every time.